Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Welcome to another installment of Gateway Today, the show that talks all things Gateway Community Health Center. I'm your host, David Cash Vasquez, and today it's back to school for you kids. That's right, parents, get ready because we've got a great show lined up for you, talking about all things you need and information required so that you can get your little ones or big ones back to school and ready for the new school year. First up, we'll talk to our Chief Clinical Officer, Ms. Rebecca Garcia Hernandez, who will break down all the services that are available for your child to be ready for the new school year. Then we'll head over to Central Clinic with Dr. Pedro Castañeda, who is a leading pediatrician here in our community, and we'll talk about all the services available for our pediatric patients. Then we'll talk to a family nurse practitioner, Megan Burns, who breaks down all the available services for pediatric patients right here at Gateway Community Health Center. And finally, we head over to our North Clinic with Dr. Rachel Dalfabro, who will break down type 1 and type 2 diabetes within our pediatric population and treatments and medications available for those patients. We got a lot of show and just in time for back to school. So sit back, relax. Another installment of Gateway Today starts now. Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. And as promised, well, it's back to school time. It's time to get your kids ready for the new school year. First up, we're talking to our Chief Clinical Officer, Rebecca Garcia Hernandez, who's breaking down all the different services available for parents who are getting ready for that new school year. Check it out. Well, as part of our back to school initiative, getting parents ready to send the kiddos back, we wanted to bring in our Chief Clinical Officer, Ms. Rebecca Garcia Hernandez, to come in and answer a few questions about those back to school efforts that we're making, everything from vaccinations to sports physicals. And so, Rebecca, thank you so much for being here with us. I wanted to ask you about those services. Tell me a little bit about what parents can expect, from Gateway when they come and visit, when they're getting their kids ready for back to school.
Sure. So, we're very excited to go back to school, right? And so...
No, kids aren't ready to go back to school.
Yes, they are. No, but so what parents can expect is just as you mentioned, we have 7 clinics within Gateway, even serving in Hebron and Zapata. And so, those services include the vaccinations, as you mentioned, and physicals. We also even have behavioral health services. And so, we're here. We are excited to serve the community.
Absolutely. It's to service the child as a whole, right? And I'm glad you brought up all the different services that we provide. So vaccines, right? Sports physicals, behavioral health. But while the child is at school, we even have other programs that parents can take advantage of, like our telehealth, right?
Absolutely. So yes, we do have a partnership with the schools, and so what that service is that to make it convenient also for the parent, the parent can have a telehealth visit, which is actually very nice service to have because the child doesn't have to leave school. If the parent agrees, they can log on and then they have the visit with a provider. So it's very convenient for them because by the time they don't have to come to the clinic, and so they'll see the child, and then by the time they go pick up their child, they can already have their prescriptions ready and everything that the child will need.
The one thing that I did want to let the public know is how easy is it or how easy are we making it for them to be patients or for their children to be patients of the clinic? Where can they register? How do they register? Where do they go?
So it actually is very easy. We serve every patient that comes through our doors. We do not turn away patients at all. Whether you're insured, uninsured, we service all patients. And it is very easy. You come in, you have clerks at the front, and so they will register you, get your information, and get you set up and get you on your way. So it's not very hard. And like I said, we do not turn away anyone that comes in. We will make sure you are seen.
Well, we're on a mission to provide high quality healthcare for everyone. And so I'm glad, again, that you brought that up because, again, it does not matter whether you're insured or uninsured or you have an ability to pay. We will service you here at any one of our Gateway clinics. You can go online to gatewaychc.com or just visit or walk into any one of our clinics and you will be taken care of. Rebecca Garcia Hernandez, our Chief Clinical Officer here at Gateway Community Health Center. Becky, thank you for your time.
Thank
and
you.
Thank you for watching another installment of Gateway Today. Our thanks to our Chief Clinical Officer, Ms. Hernandez, who again is new to the team, but is well-versed in all things Gateway Community Health Center. Well, now we're headed over to Central Clinic with Dr. Pedro Castañeda, who's breaking down all of our history within pediatrics and what parents can expect when they bring their child here to Gateway Community Health Center. All right, ladies and gentlemen, we are here at our pediatric department with one of our legends in the medical world, Dr. Pedro Castañeda. I know you laugh about that, Dr. Castañeda, but it really is an honor to speak with you about pediatrics and really ask you about your beginnings in pediatrics and how you sort of came into Gateway. Tell me a little bit about that. You started in 1976, right?
I started practice in 76. I was the second pediatrician here. And I practiced until 2015. I was on the board for Gateway for about 15 years before 2015. And I retired in 2015 at my wife's insistence on taking care of the grandchildren. And I was at home for 1 week. And Mike Trevino called me from here that they needed a pediatrician, and says, I'm going. And I've been here since 2015.
And your activeness within the organization, from board member to now our pediatrician, taking care of all the different cases that we see in pediatrics. How has it grown from 2015 to where we're at now? What's been the evolution of pediatrics here?
We have grown tremendously here. And here, I see children from birth until they're 21 years old, okay? My special kids, autistic, Down syndrome, neurologically impaired, I see them. I have a 35-year-old kid with autism that I still see. We have a comprehensive care here. We do the vision and hearing. We do the vaccinations. We have a lab. We have a pharmacy. We have psychologists. We have psychiatrists. So it's a complete. And since I've been here, we have been increasing the load from just the work getting out, from our patients that are happy being treated as a whole. Our waiting time here is about 15 minutes. We see them within 15 minutes of coming here. So they like that. We appoint and we also have walk-ins. The other big thing about this is that the walk-ins are welcome. So if they don't have an appointment, they come in and they get appointed. So
yeah, ease of care, one-stop shop when it comes to pediatrics. For the parents looking for a place to bring their kids, how do you set them at ease when they're that first time patient or they're just thinking about pediatricians or pediatric care? What do you say to those parents?
Oh, we tell them what's available here, and we tell them how well the nurses take care of the kids. We also stress that we have Saturday clinics and that we have night clinics. So if they don't miss school, they can come in. They can come in at those days. And they've been very amenable to that. They like that idea.
They like the flexibility,
yes,
I
sir.
think.
Yes,
and you know, with your time in pediatrics, before we kind of got on camera, the fun question is, how many children have you serviced in South Texas?
It's amazing. I don't know. I couldn't tell. When I got here, we went to all the deliveries. We went to all the emergency room visits. So I couldn't tell.
The man is a legend. He I think he's humble about it. But Dr. Castañeda, no, I thank you for providing that care and a little bit of a history on Gateway's pediatric department. And if you want comprehensive pediatric care for your child, we invite you to start your journey at gatewaychc.com. Come visit Dr. Castañeda and the rest of the staff. They're ready to take care of your kids right now. Our thanks to Dr. Castañeda for highlighting all the different services available here at Gateway Community Health Center. Well, we're shifting gears and headed over to our family nurse practitioner, Megan Burns, who's going to break down those services for parents who are interested in pediatrics right here at Gateway Community Health Center. Check it out. All right, ladies and gentlemen, we are here at Gateway Community Health Center, one of our pediatric examination rooms with our pediatric nurse practitioner, Ms. Megan Burns. And Megan, I wanted to ask you about that specific designation, pediatric nurse practitioner. What does that mean for, our pediatric population, parents of our pediatric patients watching or may want to become a patient? What does that mean to them?
So I'm an RN, but I also went and got my master's degree in nursing. I specialized in pediatric care, so I see pediatrics in a primary care setting and see anywhere between patients between the ages of 0 and 18.
And for the parents watching, what services are we able to provide here at Gateway Community Health Center for our pediatric patients?
So, since starting at Gateway, one of the things that I loved about it was it's kind of a one-stop shop. We have access to lab, we have access to pharmacy, we have access to other healthcare services like behavioral health, nutrition, and all of that is so important when we deal with preventative health, which is one of the main goals of pediatric care. So we will see patients for their annual physicals on a yearly basis. We see them for consults, meaning sick visits. So if you wake up in the morning and you have fever or cough, then you can absolutely come in and be scheduled. You can also come in as a walk-in, meaning that you don't have to have a scheduled appointment. You can come in. We try to get to everybody as best we can. And if not, we have night clinic services, kind of like an urgent care, and even services on Saturdays.
That's awesome. And I'm glad you brought that up, the one-stop shop, because it allows a parent, I think, to get a full comprehensive overview, right, of a patient. So tell me about that. What are you seeing in terms of patients specifically here in, South Texas? From the patients that you're seeing, what are you dealing with a lot of?
Right. So for example, one of the things that we saw, especially during the pandemic, and as we kind of come to a close with that time now, is we saw a lot of people that missed their physical appointments. So we had a lot of kids that, because they weren't going to school, were either backed up on their vaccine, so they were delayed or they were missing certain essential vaccines. We're also seeing a lot of levels of maybe depression and anxiety because we spent basically 2 years in isolation. We're also seeing maybe a little bit increased levels of obesity because of the same reason. We were stuck at home. So what's nice about coming is, one, we can catch you up on either missing vaccines, but we can also do the necessary assessments to determine if blood work is necessary, or just screening tools that we use to kind of just see how you're doing overall. What's nice, and going back to the one-stop shop, is that if we do feel like something's necessary, we can do everything here. So you can come and see me, Dr. Castañeda, any of the other providers at the other clinics. We can order what we need to order, and it can be done before you even leave the building. Once we get results, then we can kind of follow up and do things from there.
Yeah, so for LISD, UISD students, right?
Yes.
We provide all the vaccines, but what I wanted to also ask you about was the telehealth, right?
Absolutely.
And this is the ability for parents to basically get sort of seen, or their child seen, even before they leave school, right?
Absolutely.
So tell me about that.
Yes, so one of the things that we offer is when you register your child for the upcoming school year, you can designate or just say okay to becoming a patient of Gateways. And what that does is if your child were to ever visit the school nurse for anything like fever, or if they're not feeling well, you can opt to have a telehealth visit with a provider here at Gateway. From there, we can determine if medication is necessary or what needs to be done to make your child feel better. Parents are their children's best and biggest advocate. And when you either feel like something's wrong or you have a concern about the way that your child is growing, developing, their health in general in any way, we're here to serve the community. We see patients day in and day out. We try to spend as much time with them as possible. One of the things that I'm proud to say is I try to not have my patients wait a long time. Sometimes the pediatricians and everybody gets busy, or we're waiting in the emergency room and it can be hours and hours. But if I can answer your question in a quick way, then we're here to serve the community as best we can.
That's awesome. Well, hats off to you and all of the pediatric department that just continues to serve our community. I thank you for your time. Her name is Megan Burns. She's a pediatric nurse practitioner. You can visit her or any of the other staff here at Gateway Community Health Center simply by going to gatewaychc.com. Get checked, get access, do it now. Well, with back to school season in full effect, it's no wonder why she's extremely busy. Our thanks to Megan Burns for giving us her time and breaking down services within our pediatric department here at Gateway Community Health Center. Well, coming up after the break, we're headed to the North Clinic with Dr. Rachel Del Fabro, who will break down type 1 and type 2 diabetes within our pediatric population and treatments available for those patients. It's all coming up. More Gateway Today on the way. Stay close.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Welcome back to Gateway Today. Well, before the break, we told you we were headed over to our North Clinic with Dr. Rachel Del Fabro, our pediatrician, who is heavily involved in understanding the causes of type 1 and type 2 diabetes within our pediatric population. We'll talk about medications, treatments, and even possible causes of diabetes within our pediatric population. Check it out. All right, ladies and gentlemen, we are here at our Shiloh North Clinic with our pediatrician, Dr. Rachel Del Fabro, to continue that conversation about pediatrics and specifically diabetes within our pediatric population. And Dr. Del Fabro, thank you for joining us on this episode of Gateway Today. I wanted to ask you about type 1 and type 2, and really to tell me the difference between the two within our pediatric population and how we know those differences.
Okay, so type 1 and type 2 diabetes are the most common in kids. Type 1 diabetes is pretty much an autoimmune process where you're gonna have the destruction of the beta cells of the pancreas, which are the cells that produce insulin. So pretty much your body is gonna destroy the capacity of producing insulin. So the treatment for that would be pretty much administering insulin, getting insulin from outside and putting back in your body. Now, type 2 diabetes, it's a combination of resistance to insulin and also the secretion of insulin is not appropriate. So you are gonna have insulin, is just not the right amount, and your body's not gonna respond to the insulin as well. So for type 2 diabetes, you don't necessarily need to give insulin. We can do other things to manage that type of diabetes. And then you're gonna see difference in the way that the patients are gonna present as well, right? So in type 1, because you're not gonna have insulin at all, those patients are usually younger and they're gonna present with more symptoms. So if you have no insulin, the symptoms that we usually see is increasing thirst, increasing urination. Kids might lose weight, they might be very hungry. We can have other symptoms like headaches, nausea, vomiting. So you see more symptoms in kids when they present with type 1. Not always, sometimes you're able to pick it up before, but usually kids with type 1, they're gonna have symptoms. Now, type 2, because it's a more gradual process of resistance to insulin, just to go back a little, resistance to insulin is gonna be caused by overeating, sedentary lifestyle, the resulting overweight and obesity. It's a more gradual process. So those kids usually, they don't have any symptoms of the type 2 diabetes. And the way that we catch those kids, that we diagnose them, is by doing routine blood work and trying to identify risk factors to diagnose them.
And that's kind of what I wanted to talk about and let the audience know, which is the type 1 is inherent, right? Or something that
So there's a strong genetic, association. So we know that families where type 1, is prevalent, or kids that have other autoimmune problems, they have an increased chance to have type 1 diabetes. But also type 2, if you have a family that they say like, oh, diabetes runs in my family, a lot of times that's type 2. And you have a genetic component as well. So for both of them, you can have a genetic association, but not everybody that has a family with type 1 or type 2 is gonna, have diabetes. Type 1 is more like an autoimmune process, and type 2 is more related to your lifestyle plus genetics as well.
And that's what I wanted to touch on next was modifications, right? And sort of how we can prevent type 2 or even just, hope to avoid getting that within our pediatric population. How do we do that?
Yeah, so for type 1, right now, we don't have any way to actually prevent type 1 diabetes. It's an autoimmune process. Of course, we can identify risk factors and symptoms and be aware that, it's something that exists. But type 2, we do have better ways to prevent the development. It doesn't mean that if you do everything right, you're never gonna have type 2, but we have ways to kind of avoid as much as we can. So because type 2 diabetes is caused by our resistance to insulin, it's caused by the overeating, sedentary lifestyles, excess weight, if we manage those risk factors, we can avoid progressing to diabetes, right? So, for example, we always talk prevention. It's the nutrition, the exercise, right? The sedentary lifestyle, avoiding that, and weight management, right? So just to talk a little bit about those three things. So nutrition, very important to eat the least amount of processed foods that we can, avoid sugary beverages, avoid eating fast foods, increase the intake of fruits, vegetables, the real food, right? So food that it's made at home, cooked with ingredients that are fresh. This is very important. Having a nutrition assessment is something important as well. So for our kids that we see increased risk factors to develop diabetes, we can refer them to have a nutrition assessment. The other thing, exercise, also very, very important. So even if you don't lose weight, it's known that exercise and keep yourself active can help with the insulin resistance. So even if you don't lose weight, just by exercise, you can help your body use this insulin in a better way.
And I think that's important for parents to understand, because parents have the control over their children's diets, their children's activity. And so parents, if you're listening to the pediatrician, vegetables, exercise, no junk food, or limit the junk food, can actually decrease our chance of getting type 2, right?
Yes,
so
correct.
for the parents out there that are kind of wondering, how can I protect my child, or I have questions of my child has displaying symptoms of diabetes, what do you say to those parents?
Okay, so first, it's very important for parents to bring their kids for their physicals, right? So if your kid is doing okay, it's still important for you to take them to their yearly physicals for us to know if they have risk factors, we can screen them. And the way that we screen is by a physical exam. There are some signs of type 2, one that I forgot to mention, but it's one that it's important, is what we call the acanthosis. It's the darkening of the back of the neck. Sometimes the armpits get a little darker. That might be a sign of insulin resistance. We can identify that in the physical exam. We are gonna check their weight, their height, see if it's appropriate. If we see any risk factors, we can check the blood to see if there is an elevated sugar there, right? So the key for us is to catch those kids before they are actually diabetic. So when the sugar is a little high, but not too high, so we can identify those kids and start interventions, right? So it's never, I don't like to talk about forbidden foods, it's more like foods that we can eat more and foods that we have to limit, right? So the junk food, fast food, cookies, chips, those should be in smaller amounts, and fruits and veggies should be more, right? So this discussion is very important.
I think some parents are breathing a sigh of relief, right? Because everybody loves a little sweet every now, right?
Yes, every now and then, there's no problem.
For treatments, right?
Yes.
Medications, advancements when dealing with type 1 and type 2. What are you seeing out there through your research and through everything that you're seeing within the population? What are you excited about in terms of how we're going to be able here at Gateway to treat those patients?
Yeah, so remember the type 1 and type 2, there are two different problems, right? So for type 1, the treatment, because you don't have insulin, the treatment is to give insulin. Nowadays, we have more modern ways to monitor both the glucose and the way that we're going to give insulin. So we have now monitors that we can put on the skin that can keep monitoring the insulin, the glucose. So kids not necessarily need to be poking their fingers all the time. So that's one thing that is more advanced now. We have the insulin pumps. They're there for a while already, but they're getting more and more modern. So the insulin pumps are going to administer the insulin for you, so you don't necessarily need to inject yourself all the time. Now for type 2 diabetes, the main thing first is to make sure that we exercise and control our weight, the diet and everything. But for kids that the diabetes is more, let's say, advanced and the sugars are higher, we are going to start medication, right? So if it's very, very high, those kids might need insulin, but most kids do not with type 2 diabetes. We do have medication by mouth. It's called metformin. It's a very common medication. It was the only one for many, many years that we could offer to our kids besides insulin. For the last 5 years, we have some new medications that have been approved for kids. Medications that were used for the adult population for a long time, now they're being approved in kids. The injectable ones, the ones that are famous for weight loss. For example, Victoza is a medication that it's now approved for kids. So we are very excited that this is another option, another layer of intervention that we can do for those kids.
And all available through our pharmacy, right?
Correct, yes.
Awesome, and that's great news for parents because again, Gateway is about all that 100% comprehensive care for your child, and our hats off to you for continuing to treat our pediatric population. Dr. Rachel Dalfabro, our pediatrician here at our North Clinic on Shiloh. Make sure you come and visit or start your journey at gatewaychc.com. Dr. Dalfabro, thank you for your time.
Thank you very much, David.
And thank you for watching another episode of Gateway Today. Well, our thanks to Dr. Rachel Dalfabro for explaining what may be causing type 1 and type 2 diabetes within our pediatric population. And we want to issue a challenge, as we always do with most of our shows, to all parents out there getting ready for a new school year. We want you to make sure that your child is school ready. So make sure you head over to our website, gatewaychc.com, or call us 956-795-8100. It does not matter whether you have insurance or you do have insurance or you have the ability to pay for services. We're ready to help you and your child get school ready. So make sure you head over to our website and start your journey to a healthier lifestyle. As always, we want to remind you that if you want to catch a full installment of this episode or any other installment of Gateway Today, head over to our YouTube channel and simply search Gateway Community Health Center, and don't forget to smash that subscribe button. As always, we thank you for watching this installment of Gateway Today and remind you, remember, your health is your wealth, so take care of it.
COVID-19 is still impacting our community. We're helping you stay healthy. Gateway Community Health Center is providing vaccines at no cost to you. Visit any Gateway Community Health Clinic and get vaccinated. Vaccines are available at no cost for children 5 years of age and older and adults. Get the vaccine today to help our community stay healthy. Walk-ins are always welcomed. Simply visit any of our conveniently located clinics. For more information, visit gatewaychc.com or call 956-795-8100.